everybody.
Yeah, sorry, Jamie.
That's okay. Yeah, so yeah, I do a clinic at the university for staff and students, and the kind of major role is working with the performance athletes and an organisation called TAS, which is the Talented Athlete Scholarship Scheme. So that's how I kind of split my time at the uni. So yeah, today this is like the third in the kind of series. So we've worked up the body. We started at the foot and ankle, spoke about the knee last week, and now obviously we're kind of moving up a little bit more towards the hip. The reason I said to Ellen that, well, how we've done the others, for those of you that don't know, is I've kind of picked a couple of common injury related issues, talked through them, and then we've had a little bit of a discussion at the end. But with the hip, it's not almost as clear cut as like a Achilles tendon issue or a patellofemoral pain or something at the knee, and it's yeah, it is a lot more complex. So I thought I'd just kind of leave it a little bit more open. Otherwise, we'd probably take half an hour just discussing one thing that might not be relevant at all to any of you. And hip stuff in runners, yeah, it's not particularly standout. It is quite individualized. So I thought it might be a better way just to throw it out there. But and it doesn't have to be hip. Listen, you can use it however you want. If you've got anything that you want to discuss, we've got half an hour to do that. What I'll do just quickly is just speak around the kind of major reasons you might be feeling something around the hip, and then probably lead in to kind of more questions from there. So probably the most common cause of hip, and when we say hip, it's kind of the whole quadrant really around there. So you've got your hip joint, and you can get issues with that, but that's quite relatively rare. It's everything else that's around the hip, and I include the groin, the kind of adductor region, the glutes, the pelvis as the hip, and that's hence why it starts getting a little bit complicated. And muscle wise within that region, pretty much most of the muscles that move the leg, definitely the upper leg, and back muscles and lateral muscles that run down the side of your leg, all kind of are thrown into that mix as well. So there's a lot going on around there. Throw it and the abdominals. Yeah, it's a complicated area. But the most common hip related problems, I guess, main one would just be muscle related and muscle strain to a point, I guess. Like I said, there's a lot of muscles around there. Probably most commonly it would be hip flexor pain. So the muscles that run over the front of the hip and literally bend your hip, lift your knee up towards your chest, basically. Obviously, that's as a movement, a standalone movement, that's very relatable to runners, and you find a lot of, maybe not like hip flexor tears, because that is quite rare, but hip flexor involvement in a bigger picture, if that makes sense. And usually it is, we've spoke before about, it's not always just one thing that causes an issue. It's several bits and pieces that kind of combine to make this kind of irritability or pain. So hip flexors, which we can go into a bit later, and I'm sure someone will mention something around that, and probably the glutes really. The glutes obviously basically is your bum muscle, but it's split into three, and how those three muscles work and the balance of those muscles and the degree of which they kind of take a percentage of load is really key as well. So you might be able to kind of, I don't know, squat loads and it looks like you're pretty strong in your glutes and have quite a, kind of pronounced glute, but sometimes that's not always a good thing. It's all about the balance, and some of the smaller, less kind of noticeable glute muscles are actually probably your key stabilizers, which is important role of the glutes. And then the adductors, which is kind of like the muscles on the inside of your leg, and yeah, they have quite a big impact over pain around that area. And those three groups of muscles, how they interact as well. So one might be performing really well, and so well that it takes over from the others, and then the others might not be quite doing what they do, and then that imbalance over time, loaded up during running, for example, can then start to cause some issues. So it's not always like a torn muscle, a damaged ligament, a painful tendon. It can just be this upset of the balance even more around the hip, because there is so much going on. And then other specifics around there are bursa pain sometimes. So bursas basically are just fluid-filled sacs that sit at certain points of the body just to reduce friction normally. So they're normally sat between bone and muscle, and they act as buffers. And there's loads of them in the body, but they tend to all have the possibility of getting quite flared up and sore. Normally, the bursa at the hip, if you kind of feel your hips, the real kind of sticky out prominence on the outside of your hip, that's your head of femur, and there's basically one around that area. Normally, for that to be involved and for that to be a particular diagnosis, you'll have need some kind of outside pressure. So normally it probably stems from more like a fall or something like that. Goalkeepers in football get bursitis around the hips all the time just because of the constant diving onto it and again and again. But we spoke last month about the ITB syndrome at the knee, iliotibial band syndrome at the knee. That band runs from the top of the hip all the way down to the knee. So that's just as common to get it higher up as lower down. And that band is one of the things that acts over that bursa. So sometimes you can get this higher iliotibial band syndrome and or bursa irritation. But that's very specific. And if you've just got a real specific tender point over that kind of bony prominence over your hip, usually it's going to be in that region. And yeah, they're probably like the main kind of umbrella areas, really, I would say. Everything else is probably quite specific. The one thing I will mention, which I think we've kind of mentioned in the other talks, is that with runners and everybody who's consistently loading up their body or their lower limbs in particular, there's certain kind of areas that we always keep an eye on. If people come in with really specific high level pain that's causing them to stop what they're having to do, straight away that little kind of voice in the back of my head is going, make sure it's not anything bony, make sure it's not stress fracture or something like that. And the hip is an area that can occur in, again, quite rare, but that would be almost maybe more around the neck of femur. And if you're getting, pain to a point where you're really struggling to load it up and do anything, I would always want to rule that out as much as I can to start with. But that normally comes hand in hand with potentially a massive increase in mileage and load and training, basically. So that would tend to maybe be more seen in the person that's not run much at all, or the real amateur runner that's just doing, a little bit per week, that's suddenly jumping to train for a marathon, and then he's feeling this nondescript kind of non-relatable pain. So that's not, I don't think we need to really speak about that anymore. That's just something to be wary of. And I guess, yeah, throw it open now if anybody's got anything. Kind of happy to chat it through.
Do you want to write them in the chat, maybe? Because I think if we speak, that we may be on the video. That's the only downside. So if you want to write anything in the chat and ask Jamie questions.
And don't worry, if it's not hip related, don't worry. Like I said, it's just a good chance for you to get some questions over.
Yeah. Is it okay if I can ask one on the video, if that's all right?
Yeah.
Yeah. Hi there, Jamie. Yeah. So I guess I've been increasing my running over the past sort of 6 months, and there's a couple of things, and I think hips are the things I'm sort of struggling with, and it's sort of knowing when to push it, and when to let it, I guess, recover. But a couple of things that I've been getting is I've been like hip clicks sometimes, and sometimes that's just when I'm stretching, but sometimes it's a little bit when I'm running as well. I mean, is that something that's serious, or is that something that something that how would you manage that?
Yeah, that, I mean, that as that on its own, that kind of clicking hip can be an actual syndrome as such, and it's literally called clicking hip syndrome, snapping hip syndrome. That is basically, like, it boils down to muscles and tendons almost like flicking over something, whether it be another tendon or muscle underneath, or something a bit bony prominence. and it tends to normally be that hip flexor or the hip flexor muscles that are the key, or the perpetrators basically. That muscle starts actually at the lower spine, so it attaches in individual segments from the bottom 5 vertebrae at the front basically, and then runs kind of from there and runs down over the hip joint itself. Is that where you're feeling that kind of sensation, more at the front?
Yeah, but also just sort of, I guess, in the hip as well. But yeah, perhaps at the front when it does click. Yeah.
Yeah, I mean, it could. I mean, it definitely could be that. And if it was, I mean, that would in an assessment in person, that would be quite quick and easy just to determine if that's the case, because basically I would dig my fingers into that hip flexor area, and you would jump off the bed, sure. And then we would do some work in kind of releasing that a little bit. So that could definitely be something. If that's the case, that's not really going to cause a massive issue if you were to kind of carry on. I mean, obviously, like anything, let pain be a determinant factor. You know, if pain's increasing and performance is decreasing, then that would be the signal to ease off a little bit. But I think with everything, like why I say to everybody almost is that always perform within your pain limits. So a little bit of discomfort sometimes isn't always the end of the world, but obviously it's monitoring how that progresses over a run or a couple of days or a week, for example. And if you're kind of noting out of 10 the pain is quickly going from a 2 to a 3 to a 4 to a 5, either during or afterwards, then that would be enough to either decrease it and not run up to that point, or to stop altogether and seek some advice. The other thing that sometimes clicky hips generally can just be down to a decrease mobility around the hip, and we can have stiffness because of the muscle action around the hip itself that can restrict movement, or there can be something a bit deeper, more jointy, just general kind of range of movement that's stopping that. That can be worked on through kind of stretching and mobilizing the muscles, and also different physio treatments, I guess, to really get into the hip itself. A really quick and easy way of noting if you've got restrictions at the hip, and this probably applies to everybody basically, is just lie on your front, so imagine these are my legs now, bend your knees and keep your knees together, and just let your hips kind of fall out to the side. So just let gravity take them out to the side. And if you get somebody to look at, or look in the mirror or something, for example, if it's like that and you notice, that side isn't anywhere near as far as as the other side, then that would generally suggest that there's some muscle tightness, or there's some more hip specific kind of mobility issue, let's say, which is really normal. And I'd be surprised if anybody had perfect symmetry either side, because it's all down to our dominant leg, exactly, for example, and our posture that we get in during the day. And straight away it might just be worth doing a little bit more around that area, and that might just be getting your ball into your glutes. It might be rolling your quads, and just doing some simple things like that, and the general stretches around the area. If you notice that and there's symptoms beyond just a bit of tightness, then sometimes that, I would say, that's probably enough to maybe go and get it looked at, to go in and say, I'm getting pain, but I'm also noticing I'm a little bit stiff around this hip, etc., etc. But yeah, I think
great, thanks.
I think the likely thing is probably that snapping hip, which is basically muscle tightness over the front of the hip.
Okay, great, thanks a lot.
Right, let's have a little delve into the chat. Have you noticed any increased hip injuries, involvement with people working and living differently in lockdown? Any tips for people seated a lot? Yeah, and that probably relates to something we've just been talking about there. Obviously, more prolonged sitting will mean more positions in a hip flexed or bent position. Obviously, people are kind of making do with what they've got at home, and their desks and chairs aren't always going to be, perfect. So, for example, now I'm sat on one of my little girl's chairs to go around her little table, so I'm like in a ridiculously overflexed position. My knees are nearly touching my chin. So yeah, I've noticed that particularly, maybe not specifically around the hip, but definitely around general issues like neck pain, back pain, and stuff like that. But in relation to the hip, it probably will be being in that over flexed position and just increased tightness. So if you flex anything, then you're going to get a tightness over, you're going to get like a stretch over the back, but a tightness over the front. And if that's the hip, you're going to get that tightness in well, lots of areas, but in the hip flexor position, and you're probably going to get a lengthening in the glute. So if you imagine you sat on a bike, like leant over on your bike, kind of pedaling away, that's kind of a similar picture. You're going to be overflexed in the front, and you're going to be overstretched, if you will, in the back. So that now and again is not going to cause any issue at all. That prolonged, you know, sitting at that desk for hours a day, going on your bike for hours a day, and I see it in cyclists loads, is that, yeah, they just become inefficient in both areas. Inefficient in the glutes because they're always in a lengthened position, and inefficient in the kind of front of the hip muscles, the hip flexor muscles, because they're always in a shortened position. So I would say that's the main thing. And again, like as I said to Sam, it's then identifying those areas, and probably the things you can do yourself are, for example, hip flexor stretching and maybe some glute exercises just to make them a little bit more efficient and fire them up. Because in anybody, glutes obviously is relevant to talking around hips, but I think I mentioned glutes talking about the ankle, and I think I mentioned glutes talking about the knee. They're my kind of go-to thing for most things, and especially, you know, active people and runners, because they're just, if they're working well, everything else tends to work pretty well. So that's a sweeping statement, obviously, but I would be focusing on that area. So yeah, I know I'm kind of skirting over it quite quickly because I'm aware of time, but I think that would be the main postural position that I'm seeing at the minute. People kind of bent over more over desks. Where am I now? Let's have a look. So everyone always seems to get told we don't activate our glutes properly. How can we do this? Yeah, there we go. So there is, I have a few, like I said, going to go to exercises that I just throw out really generally for people, not just if they're getting pain in their glute or it's a real obvious glute issue, just anybody who does any activity probably needs to keep on top of their glutes. So I have got some good glute activation things, probably things that you've seen or done maybe already, because they're nothing special or new particularly, but they're the ones I use quite regularly. What I think I'll do, like previously, if I get them out on video to people, and then you've got a record of them and a little explanation of how to do them. Most of you probably are set up already with a profile on the Physio Tech kind of app or library. If you haven't, we'll get your emails after, and I'll set people up. And what we're doing now is just adding videos to your own profile. But I might actually make my own around that, because it's almost like a little sequence that I do. So you kind of do one straight into another one, straight into another one, and that hits all the separate areas, you know, like the different areas of the glutes like we spoke about before, and just puts them in a state of readiness basically to cope with whatever they need. So yeah, I'll get that out to everybody.
Just say, Jamie, I've got everybody's details for today, so I've got all their email addresses already, everybody that's on here, so that's fine. Right, great.
That's easy enough. Right, moving on. Dull pain in the top right buttock that can make my right knee ache. How can I eliminate this? Right, that could be several things. I suppose if I start asking that person questions now, then we'll know who's asked that question for the video. But I mean, it's up to that person, obviously.
You can ask me. You can ask me.
Well, that's your question, isn't it?
Yeah, it's my question.
Yeah. So where are you getting the ache around the knee? Where, like front, back, side?
Oh, you know what? It's just after running sometimes, or overdoing it, in bed, killing. Ache, like keeps me awake at night. But then it's all right. You know, the actual movement's fine. But
and are you getting does it come in that kind of pattern? So you'll be feeling that pain at the right buttock, and then subsequently you'll feel the knee.
I've always got at the top of my right buttock. I think it's a disc or something. I don't know. I just don't know. I've always got that dull pain there. Yeah, it's constantly there. Maybe it's a sciatica, I don't know, but then it would go flowing through to, if it was really bad, I have had it in my foot. Do you know what I mean? It's hard to move.
Yeah.
But over the years, just recently, it's just after netball or moving around or some long runs, it definitely irritates from there, and it goes down the side of my leg, but into my knee. It's like,
yeah. I mean, that was my first instinct was to say that's almost like a referral type pain, and essentially sciatic type. I mean, sciatic nerve runs down the back really, but there's loads of other nerves that run across that area and run through a muscle called the piriformis.
Yes.
And it actually runs through the muscle. So if you're tight or overworked in that muscle, it can obviously, kind of affect and pinch a little bit, and that's probably when you get that referral type pain.
Stretching, rolling.
Yeah, definitely getting into the glute. So like we said, with the ball's the best thing, up against the wall or on your chair, constantly getting into it, and maybe just a little bit of glute stretch, which again I'll put glute stretches and glute release in the the exercises that I send out. That would be, I mean, there's a lot more involved. If that's what it is, there's a lot more involved as well, and we would work a lot higher up, kind of around the back, and there's some tests to determine whether it is that or not. So, but just doing that for now is safe, risk-free, and may have quite an instant effect. So yeah, I'll tag some more kind of glute specific release and stretch on as well to the bits. So what glute exercises should we be doing? Right, yeah, so I guess that goes back to what we said. I'll tell you exactly what to do, or I'll show you. I'll send the videos, and they'll, in relation to balance, it's getting the balance of the different glutes right, and it's also getting the balance of particularly glute to adductor. So I'll throw some adductors in there as well, and it's about things firing at the right time and being able to cope with what they need to cope with at any given minute. So I'll make sure that it's not just a glute heavy kind of exercise session. It's a bit of everything. Okay, pain in the anterior hip crease when hip crease very medial near the top of the adductors, specifically when raising knee, and definitely worse when the legs rotated outwards. Okay, so yeah, I mean, it is difficult to try and diagnose as such, and this isn't, I normally say this as a disclaimer at the start, this isn't like a diagnostic session. Obviously this is just more kind of tips. So what things that potentially could be, I mean, across the hip crease is where a lot of those muscles run over. Also in the hip crease, that's where, as you would expect, the hip joint is itself. So if you bend your leg and push your thumb in, you're normally right over the hip joint itself. So if it's on the medial side and near the adductors, obviously it could be some adductor input there, adductor tightness, potentially adductor overworking, that balance between, like we just said, adductor and glutes. If we are inefficient in your glutes, the adductors will tend to work more. And sometimes an easy way of knowing is just to have a feel in there. And if, even when you're like resting the leg on the floor and you're feeling in the inside of the leg, if you're feeling, kind of tone and tension even at rest, then generally that muscle, in this case the adductors, are probably overworking. That happens a lot in the hamstring. You rest the leg on the floor and you feel your hamstring and it's still kind of firm and quite solid, and that just means it's kind of performing even at rest, and that can be the same definitely at the adductors. When the legs rotated outwards, so that's putting rotation through the hip, and that will engage different muscles in that position, but it will also cause the joint itself, obviously, to depends what way you're rotating it, or if you say outwards, I presume you mean like letting your foot hang out. That's actually internally rotating the hip, so it's actually adding pressure, I guess, to the hip joint itself. So I think with that one, I'd be wanting to make sure I'd look at the hip joint itself and make sure the hip joint was clear as such, and there wasn't particularly anything joint related going on, which I probably don't think there would be, but I would definitely want to get that checked. And then like we've said before about scraping, like peeling back layers. Once we're kind of thinking maybe it's not that, then we would look at that muscle balance and that kind of muscle relationship. Yeah, that if that's the case, that's one I would probably say, and whether it's with me or not, I would probably go and have that looked at, just because that could be so many things, and it might be nothing and it might be something. So yeah, I would probably say that's worth getting a look and a full assessment, because yeah, there's plenty that could be going on there. I'm gonna have to move on. I think we've got 2 more. So, been struggling with hip pain on and off for the last couple of months, irritated by running. I think hip flexor, as it makes lifting the knee in front of me sore, but also radiates down the outside of the knee. So a physio before Christmas who gave glute strengthening exercises, doesn't seem to resolving. Is there anything else? Please don't say stop running. Well, don't stop running, so that'll make you happy. Unless it's, like we said before, unless it's significantly changing and causing you to, change your running gait, or there's a slight limp, or you're having to really overcompensate just to get through a run, for example. And like we said, also just monitoring that pain scale and making sure that that's not getting beyond comfortable either through the run or probably as importantly, like after, in the next 24 hours. So let that be your guide. But again, if it's lifting the knee up, generally that's a hip flexor movement. Your hip flexors are performing that movement. So it's, yeah, I think hip flexors are definitely a potential issue there. Radiating down the outside of the knee, so that could be the lateral muscles, or the IT bands, which we spoke about before, potentially. Anything that radiates, like we said with Gail, and with its proximity to the lower back, we always want to check kind of nerve involvement. And normally with any hip pain, we'd be saying straight away, have you had any previous back history, or or anything noticeable around the back, because that's again the first layer that I'd want to kind of peel off as such. Yeah, glute strengthening, I mean, like I said, that tends to be where we kind of go straight in at with some glute bits, just because it kind of covers many bases. But if it's not having a direct effect, then it kind of rules out, to a point, glute inefficiency. That on it, there's normally, like I said before, right at the start, there's normally so many kind of different things going on around the hip that it's kind of rare. It's one thing anyway. So just having, say, weak glutes wouldn't be the primary issue anyway. There would be something else and something else alongside that over a period of time that would have then got to the point of pain. So that would have been a portion of probably what's going on anyway. But it's still by doing that and resolving that issue a little bit, it's still useful information. Again, really difficult kind of now without seeing anything, but I think I would start with some hip flexor specific rolling. So get on your roller, get on your quads. It's hard to get in the hip flexors just because of they're so deep. They're kind of under the abdominal area, and they run very deep to lots of other muscles. So I mean, there's some techniques from a physio point of view that do, which I get right in there and get you to move your leg at the same time, and it's quite effective at releasing the hip flexors. But it's almost impossible to do yourself, even from the very least. That just you getting into it, you're going to have this kind of subconscious reaction of tightening up and stopping yourself. And how you position your leg, obviously, even just resting the leg sometimes can put tone through the muscle. So it's hard to do, but rolling around the area would be useful. Again, I think if it's on and off for the last couple of months and it's specifically irritated by running, there's probably enough there to say it might be worth getting that looked at in a bit more detail as well. I'm going to have to move on. I know I've not really been probably that helpful with that one, but I've also got a school run to do in 5 minutes, and anything could be happening upstairs at the minute. So I'm expecting chocolate spread over their mouths and then halfway through a film. So last one, I've had hip pain a couple of years ago. Sports therapist diagnosed tight rotators and underused glutes. Doing his recommended exercise included lots of glute activation, pre-runs, fixed the hip pain, but now I've started to get what feels like lower back pain. Yeah. foot is in the glutes, not when running, but after. I'm doing more running and much less cycling. Okay, yeah, so tight rotators are another very common thing that we find, and underused glutes, and they almost go hand in hand. The rotators are kind of doing too much, and the glutes are just sitting back, hands behind the head, going, oh, this is great, I don't really need to do much. So again, that glute activation stuff seems to have affected it to a point, but like we said about there being a couple of jigsaw pieces, that's probably got you so far. And it's not, yeah, it's not kind of resolved the whole issue. Sometimes you, by peeling back layers, like we've said, and doing something specific, it takes away maybe what you thought was your main issue, but then exposes something else. And that's really common, you know, like the primary issue is maybe resolved, but then something else that's probably has been going on but's not been, you know, consciously, I guess, you know, in the forefront of your mind is then kind of put in the forefront of your mind. So let's just have a quick look. So fix it, but now start to get what feels like lower back pain. Right, okay. So if you've been doing a lot of glute work, it can exert quite a little bit of, I guess, load and pressure around the lower back. It depends what you've been doing basically and how you've been doing it. I mean, I think you've said you're happy to talk on video, so I guess just really quickly, what kind of stuff have you been doing?
I've been doing glute activation with bridges, with static lunges, and then just twisting at the hips with a sort of lie on my front and do the froggy legs and tighten the glutes that way. But I'm probably not doing the jigsaw, as you mentioned, to get all of the different muscles. There's probably something that's weaker than the rest or not getting warmed up.
Yeah, and it kind of, I mean, it feels like I always kind of relate back to that, but it is, well, the way I work anyway, I feel like that is key, and it's not just, again, we've mentioned this before, but it won't just be in that hip area, you know, it might, you know, now you notice in the back, and the back there was probably some postural issues, say, with the back, and even higher up around the kind of ribs and stuff ages ago. But yeah, but sometimes you have to do something to really make that kind of highlighted. I think the three things you've mentioned there in terms of what you're doing with the glute all have quite a bit of potential loading of the lower back. Either if you're not doing it quite right from a technical point of view, which I'm sure you are, because they're not crazily difficult things, but yeah, they all have the potential to load and force you into a little bit of lower back extension. And if your general back posture or your general posture fits into that as well, then you might just have shifted the problem up a little bit, potentially. So I think I would, if you maybe a little bit of core work, basic core work, that, you know, if it was like a hip extension, a back extension loading issue through some of the exercises you're doing, that kind of the counteraction of that is to get the core nice and solid, really, I would say. And again, that kind of core glutes adductor thing triangle is, you know, is every point of the triangle needs to be as good as the other one, basically. So I mean, yeah, like, again, like, without trying to diagnose anything, I guess doing some core work isn't going to put you at risk at all, definitely. And I would say then, yeah, you probably just need to make sure that, or again, get someone to maybe cast their eye over if there is anything posturally obvious at the lower back or the pelvis. Sometimes when were you doing both sides of the glutes, or were you focusing on one in particular?
I'm doing both sides. Yeah.
Do you notice a stronger side when it comes to that kind of exercise? Is one size easier to?
I don't really know, but I definitely had my right was a lot tighter.
Right. Okay. And tightness, sometimes perceived tightness isn't always actual muscle tightness. It can be overworking, overperforming of that muscle that makes it feel tight, if you know what I mean. So that tightness could actually have been that right glute was having to work more for whatever reason, which would then start to go down the route of, well, maybe there is a right side asymmetry, and we'd want to be looking then, like I said, at, you know, the hip hip range on that side and pelvic position, and then higher up into the back as well a little bit. So yeah, again, that might be worth just you know, casting eyes over a little bit further. And I don't mind that, as you know, if you've got my emails, I think you've got my email address, most people. So obviously we're restricted by time. I can definitely kind of give a little bit more advice that maybe doesn't lend itself to booking an appointment. But I think, yeah, if you focus on a bit more core related stuff, figure out if there maybe is a little bit of an imbalance right to left, even if you just do the, you know, the hip rotation thing on your front, and do a couple of things like a one leg squat, for example, and just feel if one looks better or feels easier performing them, maybe not just doing one, doing a few in the mirror, and that gives you more information, I guess, going forward as well. That's the last one I think I've got here, and I am going to have to shoot now, but thanks for coming, everybody, again. I'll get those exercises, Gail, onto everybody's profile, and I might put something together separate as like a little pre-run, my ideal pre-run kind of the way. But then you, at the minute, you have to book through the Armitage Bookings website, and you have to get a membership number. It's complicated, and there's an email address to email to get that set up. You don't have to pay for that membership. You obviously do have to pay for your appointment. But I guess if anybody's looking to do that and they're struggling to do it, or they're not sure how to do it, or they want to have a chat through before they book anything, just email me directly, and kind of happy to talk about things in a bit more detail.